Hello, my name is Eric Jensen. I'm a senior research fellow at the Institute for Psychological Research at the Sigmund Freud University, Berlin. And I'm going to be presenting here about preliminary findings from the first week of data collection in the viral communication project. This is a survey study based on a representative sample of the German population. And we did that using postcards that were distributed widely across Germany. So I'm just going to run through some of our initial findings from some of our public opinion survey questions. You can see here a number of questions about people's personal perspectives on the coronavirus COVID-19 situation, including the level of concern people are feeling, the level of concern they're feeling about their health versus financial situation, versus whether they're feeling like they're safe in the context of the regulations that are currently in place, and how concerned they are overall about the damage to the German economy. And you can see that the level of concern is more skewed towards health than personal financial situation, and that the greatest concern is about the overall damage to the German economy. So green means agreement with these statements here. I'm concerned about my own health. You can see the strong level of agreement there. I'm concerned about my financial situation. You can see that it skews a little bit towards agreement, but actually pretty evenly split about whether people feel personally affected. And there's also the regulations, whether those make people feel more safe. You can see that it skews a little bit towards agreement, but basically pretty split. And the one where there's widespread agreement is that this situation is damaging to the German economy. So more attitudes about people's personal perspective on the coronavirus. So here's the first statement is, I am concerned that I could infect others with coronavirus COVID-19. And there you see majority agreement with that concern. But you see that get stronger when the statement is put at the more close focus on family and friends. So here, the statement, I am concerned about the health of my family/friends. This gets a stronger level of agreement than just general concern about infecting others. Corona regulations anger me. Here there is a split, but a majority disagree with that idea that corona regulations anger me. Corona regulations scare me. So here you can see there is a sizable minority that agree with that statement, but a majority who disagree. And then the coronavirus is generally harmless. This is something that gets very strong disagreement. So 61% is the strongest level of disagreement, and then others disagree as well. So only a small number actually think that the coronavirus is generally harmless in Germany. Next, we look at public attitudes about mitigation measures. So mitigation measures about protecting oneself and others. So the first is avoiding foreigners. We asked whether people saw this as an effective mitigation measure, and it was split, but overall skewed towards people agreeing that avoiding foreigners was a good way to protect oneself and others against coronavirus infection. Then there was the CoronaWarn app, the German app for test and trace. And we can see that there's a split with a lot of neutral responses. So there's a lot of uncertainty about the effectiveness of this intervention, the app. Then using hand sanitizer or washing your hands after visiting public spaces. This gets overwhelming agreement that this is an effective measure to protect oneself and others against infection, with only a tiny percentage disagreeing with that idea. And wearing masks also gets very strong agreement that it's effective. We also asked about avoiding crowded indoor spaces, and here you can see overwhelming agreement that that is effective. Avoiding other people in general got less agreement, more of a dissent, although not strong disagreement. Mandatory quarantine for people who had close contact with confirmed coronavirus cases got very strong level of agreement that that's effective. Maintaining a distance of at least 1.5 meters from other people, again, very strong agreement. We then asked about what if these measures were made more mandatory. So particularly if we look ahead to vaccination, what are the attitudes about vaccination, and does it matter if it's an injection or a pill in people's minds? Does that affect the psychology of response to the idea of coronavirus vaccination? And here we can see that there would be majority public acceptance of mandatory coronavirus vaccination, which is an interesting finding. And it is stronger, coronavirus vaccination, support for making that mandatory is stronger than support for making seasonal flu vaccination mandatory. And we asked on the flip side about voluntary measures. So would the individual we were asking be willing to take these steps on a voluntary basis? And here the level of agreement is stronger, that the people who would be willing to take coronavirus vaccination is at a pretty high level, although there's still 15% who say whether something is in pill or injection form, they're not interested in taking vaccination and would not do it on a voluntary basis. And then the seasonal flu has about the same level of resistance and slightly less strong agreement that people would do that on a voluntary basis. So we asked people about the steps they've taken to, in terms of mitigation, and we found that wearing a protective mask when they're not required to, when it's not mandatory, actually gets a minority level of agreement in this sample of the German population. And on the other hand, avoiding crowded indoor spaces gets very strong agreement that people have done that within the last 2 weeks. Using the Corona Warn app, despite the reservations about effectiveness, a significant minority of respondents indicated that they have been using it in the last 2 weeks. And avoiding other people in general gets a similar level of positive response, but you can see it's split. So avoiding crowded indoor spaces is one of the in terms of personal mitigation behaviors that people have taken themselves within the last 2 weeks, using hand sanitizer or washing their hands after visiting public spaces was widely confirmed that that's something that people were doing. Maintaining social distance, widely confirmed. Wearing a mask when it was mandatory, 88% strong agreement. So where masks were mandatory, this was very effective at getting people to comply. Avoiding foreigners was more of a split. The majority disagreed, but there was a sizable minority who have been doing that as a mitigation behavior. And then trust in information sources. So where do people look to for trusted information in this context? You can see that there's very similar levels of support for trusted sources, looking at Merkel, Drosten, the German virologist, WHO, state government. These are all pretty similar, although the strongest ratings were for Merkel and Drosten. And then also for the Robert Koch Institute, a specialist scientific institute in this area. But you can see that the level of trust is pretty high, as well as the trust in the primary news source that our respondents selected. So we gave them a choice of a lot of different news sources, and then we asked whatever one they selected, how much do you trust it? And you can see that actually gets the most strong level of support. Whatever news source they have selected for news media gets the highest rating. And finally, we asked people about their overall health situation. And you can see that people have faced major challenges during this time at the level of tensions in the household. So this has been a key issue at 41%, and negative effects on mental health at 81%. So these are the preliminary findings. Go to our website, viralcom.info. You can see there, and follow us on Facebook or Twitter to find out our results.